In 2016, 5.6 million child deaths under the age of 5 were recorded, and a staggering 46% were in the first month of life.
One of the greatest contributors to babies dying before the age of 1 in much of the developing world is got to be the lack of breastfeeding.
There is literally zero knowledge about breastfeeding.
All I knew is that my baby was supposed to be just latching on and feeding and happiness, and that was not happening.
We were looking for help, but we didn't quite know where to look for help.
We've said pregnancy and birth are all these terribly, highly technical medical events. Now suddenly being a mother is supposed to be natural.
We don't yet live in a breastfeeding culture.
I'm doing my best and it's not good enough, and I'm not good enough.
I still remember that night. I just couldn't have a closure on this.
Tongue tie, or ankylosing, is a congenital condition that has been linked to significant breastfeeding challenges. Recent ultrasound studies have shown us that the restrictions caused by a tongue tie can impede breastfeeding.
We found that 10.7% of babies had a tongue tie, and the incidence has been controversial.
And there's a whole host of potential biomechanical things that we don't even know about yet.
And this ambiguity makes things even more difficult for mothers.
That tongue that's really stressing can interfere with so many different bodily functions.
Beginning with breastfeeding at infancy.
We have so many grow-up patients coming to our office.
I think mothers that have a really difficult time with breastfeeding and don't reach their goals and haven't been supported are allowed to be angry.
Like, that's how you feel. Like, I'm broken. I can't do the most basic thing on the earth, which is feeding my baby.